Hello everyone, I am Dr. Gobind Rai Garg. I did my MBBS and then MD Pharmacology, and I am in this medical field since 1997, that is around 25 years now. Today I want to discuss something very important with you all. The question that one must consider before stepping into world of medical science, that is, who should become a doctor? For becoming a doctor, you should have a will to learn despite failures, will to put others before your own self, and you should not get discouraged even under pressure. These are the basic qualities you should have. Now, being a doctor is a journey in itself. Right from your medical school, you will have to burn the midnight oil. First to clear your professional examinations and then to clear PG examinations. You will be exhausted with lots of syllabus. You need to deal with the failures. What I meant, in the schools, all of you who are going to become a doctor, you are toppers among your schools. And now in the medical college, all are toppers. So you need to compete with other toppers. Yeah? So many times it becomes very difficult because you are not used to get to the second or third position, and now you are getting 20th, 30th, 40th position. Yeah? So you need to deal with the failures. When you go to the postings in the hospitals, you will see a lot of suffering, trauma, emotional burnouts. So these all things, they may drain you. And furthermore, in medical colleges, it is very common that you get scolded out in front of other doctors, in front of nurses, patients, and even ward boys. So you need to deal with all these things. After doing your MBBS, there is a lot of peer pressure to do PG entrance. So you need to prepare for PG entrance exams, and even after qualifying for PG entrance exams, the residency is quite hectic. Sometimes you need to do 72 hours duties and even more without any breaks. So you might even have to sacrifice your sleep, your social life, your hobbies, and relationships also. It doesn't end there. The struggle continues once you become a doctor. After you become a doctor, you should be available 24/7 for any emergency. So there is no guarantee of a night's sleep, no guarantee of a peaceful life. You should also have the courage to address the family members in case of any casualty. You need to tell the relatives of the patients about the imminent death of the patient and many such emotional things. So you must be a frontliner in emergencies. You must have seen COVID, when the people were sitting in their home कि मुझे कुछ हो ना जाए, the doctors had to go out and treat the patients. And complicating all these, the most unlucky thing now which is happening is the physical assaults. Anything goes wrong, the relatives of the patients, they may attack you and your hospital may be ransacked. Plus in today's world, there may be true or maybe even without any of your faults, you may get into litigations. So these are lot of challenges in being a doctor. डर गए? But trust me, in the end, it's all worth it. The sense of relief that you get after saving a life, after curing an illness, after bringing smiles is beyond measure. If you think you have what it takes for being a doctor, then go for it. If you think to make these sacrifices and your social life, then go for it. If you think you are willing to make the sacrifices and overcome the challenges that I talked about earlier, then you are the perfect candidate to become a doctor. So if you decide to become a doctor, I wish you all the very best. It is one of the most selfless and noble career options. This Doctor's Day, I salute all the doctors and wish all the very best to all the upcoming doctors. Thank you.